Hello, everyone. Today we have our consultant optometrist, Mr. Bibek Pratap Singh. And in today's episode, we'll be talking about albinism. We are raising awareness as Lusaka Eye Hospital on the condition albinism, and we hope that this conversation is going to be insightful. I will be asking our consultant a few questions, and he's going to elaborate them for us all to understand what this conversation is about. Good morning.
Good morning, patients.
Okay, so our first question goes, how would you explain albinism to the general public?
So, in general public, basically, there are a lot of misconception which happens in cases of albinism. What we have to understand in generally is albinism is a genetical disorder. It's not contagious. It cannot harm someone. So, considering that one, what albinism specifically means, albin means white, and ism is a disease condition or whatever. Basically, in albinism, more importantly, we have to understand is a genetically condition is not something which you get it because of any specific disease during your second or third decade of life. Usually it happens from the birth itself, so that public need to be aware. And we are definitely going to be helping in a few more steps how the albinism is going to contribute in the eyes, how the body affects and everything. Definitely will give you answer to that.
Society has noticed that most albinos do have challenges with their eyes. So, as an eye specialist, would you explain how albinism affects the vision?
Yes, in albinism, basically, what happens to our eyes, it has, due to albinism, we have less pigmentation in the body. That is melanin pigment. Sometimes it can be partially available. Sometimes it can be completely not present in the body, and because of that, you know the pigments what we get, the color of the body, the hair color, and the color for iris in the eye, all these are helped by the melanin pigment. So considering that one, if the melanin pigment is partially or completely absent, that means it's really going to give lot of trouble in terms of the vision as well. Like in general, usually the uh, patients uh, or a person who has albinism, they tend to get a lot of photophobia when they are exposed to the bright light. And not only albinism is related to the ocular disease. If we take it, it is in general, it's slightly more, we need to make conscious programs about albinism, because it can also affect the skin. And usually the thought for public in general they have about albinism is that it's okay, it has just affected the eye, it has reduced the vision, my child is not able to see. But apart from that, definitely there is also high risk of developing a skin cancer because of the less melanin pigment. So when we talk about albinism or when we are discussing about it, we need to be very careful what we have to intervene and how we can move forward with the treatment process. That is what is going to be much more helpful. And in terms of the vision, yes, they tend to develop high refractive errors, like mixed astigmatism kind of thing. So this also reduces the vision, and then they have a lot of photophobia due to glare issue. So these are the one which contributes really to reduce in the vision.
Okay, that's a very powerful explanation. So, what are some features that parents can look out for when they're nursing a patient or a child with albino? What can they see in the eyes for them to know to say, okay, this child needs to be seen by a specialist?
Usually, if not, I'm taking it in general, any child who is struggling to see at certain distance, then that is one thing they have to be aware of. Or if you see your child is placing a phone or watching a video on a television when they are going closer. So anything when if you notice that if they are putting the mobile videos too close to their eye to see things, and then also at the same time if you feel like when they are moving out in the bright sunlight and they try to squeeze their eyes to see clearly, that also is one of the indicative part where parent need to be aware. And in early stages, one thing we have to understand is most of the people are aware about albinism conditions. So when a child is born, immediately it has to be, you should not delay, like when child will grow and that's when you will go to consult eye specialist or a dermatologist. Immediately once they're born, first month of the life itself, the treatment has to be start. As early you intervene, the better the vision you can give to the patient. Yeah.
With everything that has been spoken, what services are available at Lusaka Eye Hospital for patients with albinism or children that are struggling with low vision?
So at Lusaka Eye Hospital, definitely we have a trained team for optometrists who tackle these conditions very well. So usually, when it comes to albinism, usually the child develops, in most of the cases, they have low vision. That means, in a way, if I have to make in general or layman term, that your vision is not as good as it is supposed to be. And considering that one, we have a certain specific device which is going to help people to enhance their vision. And when we talk about enhancing, patient with albinism, as I was discussed earlier, that they tend to develop photophobia. So in photophobia, we need to understand that it's not only a photochromatic lenses which is going to reduce the photophobia. They need the tinted and specific lenses depending on the glare issue what they are facing. So usually to tackle all this, we have specific devices which really help us to understand what struggle they are facing, and depending on that we give the devices to them which can enhance their vision in a better way. And there are certain online applications as well which need a bit of training. Those application you can use it on the phone, and then it can enhance your sight even if you don't have the devices. So for that one, a mild, let's say a training for 1 hour or 2 hour in the hospital we give, and then patient has responded very well with that.
Okay, that's a very wonderful explanation. And now, to sum up everything that you have spoken, what would be your message to parents that are withholding their children from getting this proper examination?
So the message to the parent that they have to understand that their child has full right to go to a normal school. They can do any task which any normal individual can do. That means they are fully able to do all the task which is required. It's not putting them in the blind school or where they need their special needs. Usually if the intervention is started earlier, they can achieve very good vision. Though there is a part of involuntary moment, like where you see the nystagmus where the eye is continuously shaking. So these are also one of the indication which parent has to look. So considering all this, when we talk about giving the awareness to the parent, they need to know that their child are as good as the normal children go to the school. It's not like you keep them home, you have to keep them away from the community. Those things should not be there, because they have full right to get the proper education. And that is why we are making this low vision awareness program to the community, so that they understand that there is a hospital which is going to treat their children in a specific way, that they can go to the normal school and attend their all to their day-to-day activities.
Thank you so
Okay.
much. It has been a quite insightful conversation with our consultant optometrist. Let us bring all the albino children that we know, all children that are struggling with seeing closer or at distance, any child that you have noticed that may be having this struggle with their vision, please feel free to bring them over to Lusaka Eye Hospital. We have services that are specifically designed for these children. Thank you.